Hi, I'm Dr. Duke, and I'm going to show you a turbocharged treatment of how we handle hamstring tears inside the office. And this is Melissa. She's our model today. She's a local runner here in New York. Thank you so much. All right, first thing, I don't go right to the hamstring. I look at body alignment. Definitely something's off over here. So first, I like to mobilize the ankle. I also like to mobilize the foot. Bend your leg for me. Granted, turbocharged. And then, runners need push off with the big toe, so I have to get into that joint to make sure that she is able to have that push off. Otherwise, she will compensate and use other muscles, and maybe that's why the hamstring tore in the first place. Pelvis is off, so I'm going to have you lie on your side, face this way for me. You can't run with an unlevel pelvis. It'll just put unequal weight bearing on the hamstring and other muscles and tendons, and then maybe that's why the hamstring tore. Arch your back a little bit, so we do a little body alignment. Perfect. Lie on your back again. Check the alignment again. Nice. Now, what I'd like you to do is lie on your stomach. Face down. Thanks so much. Active release technique is a way where I can palpate and find exactly where the strain or tear is, and then I have the patient actively move while I release the scarring or adhesions. And we do it in a number of different ways. I like to release the IT band from the hamstring. I like to release the hamstring from underneath the calf. And then I like to release the lateral hamstring underneath the calf. As a matter of fact, I kind of like to release the calf and get a little more pliability to the back part of the popliteal fossa. I know it's his hamstring, but I'm going to have her lie on her side and face the camera. Lie and face the camera for me. Bend this leg. I also like to get to the hip rotators. So I'm going to work on the piriformis. That's a hip rotator. Bend your knee up towards your chest. Drop it all the way down to the ground. Bring it all the way back for me. I also like to get into the hip flexors. So we'll try to get a pure biomechanical approach to getting this athlete more limber. Now, grab this rope for me. What's commonly missed in hamstring issues is not the actual hamstring, but on the back part of the lower back, it's called the dorsal sacral fascia. And the only way to really get it is to have the athlete bring the leg as high up towards her chest. She's not very flexible. Keep going. There we are. And now I'm able to release the tension on the back part of that sacrum. Hold that right there. We use many instruments inside the office. So I'm going to take a little bit of the Graston ointment. We're going to bring her leg up. And then right at that ischial tuberosity, I'll take the Graston and I'll find, again, with the expert palpation skills, and just get right on that ischial tube where it attaches and get some blood supply into that area, break up the superficial scarring that's occurring. Try to get rid of those hashtags of scar tissue that really limits mobility. Last thing, Melissa, lie on your back for me and keep the rope in your hand. You can't just work the muscle in one direction. You have to work it in many different directions. At Duke Chiropractic, all the doctors in our office are expert at soft tissue rehabilitation. And then following treatments like this, if it's really chronic, we'll bring out something called radial shockwave therapy in order to burst the scar tissue and enhance the blood supply.